This is Melissa. Why do I say this?
Why do you say what? This
Instead
is.
of I am.
This
Isn't it
is
funny?
Melissa Cady. This is Dr. Melissa Cady speaking. This is.
And why do I do that? I was listening to myself. I'm like, why do I say this is? I am Melissa Cady, the challenge doctor, and here is.
Oh, you know what? No, I say this is, I think, too.
Do you?
This is, yeah, and I'll tell you the reason why is it has to do with the doctor part. Right? I hate it when people say my name is Dr. Kevin Cuccaro. I cannot stand that, because your name is not Dr. Kevin Cuccaro. Your name is Kevin Cuccaro. You are a doctor, right? And so I never say that, like the I am thing. And I think if you say I'm Dr. Melissa Cady, I think it's sort of almost, wow, I don't know. That's interesting, right? Because it's I am, maybe that's your identity.
The Change Physician podcast.
This is the Change Physician.
I am Melissa Cady with my co-host, Dr. Kevin Cuccaro.
What do I do? What do I say? I am. I think I say this, but I think I say that this is because, and I like that you brought this up, because I think I see myself as separate from the doctor. I don't see doctor as part of my identity.
Yeah.
It's a profession. It's something. Well, I shouldn't say not part of my identity, but I don't identify predominantly as a doctor.
Yeah. So you know what? I think, we had a plan for this episode. I think we should just roll with this and talk about.
Yeah, no, I think this is interesting.
Called doctor, because I kind of want people to just, call me, Melissa, or unless it's right in front of a patient, so it helps identify who's who, just for orientation.
Yeah.
But I will tell you, I'm going to start off with an example. I had a patient who was granted, it was probably drug induced. It was being really combative and really a jerk, and was calling, nurses and me, like, said that this patient hated us and called us BIT, you know what. And I was trying to make it very clear when they said to me, I hate you. I said, sir, ma'am, you signed up for this. And I'm trying to reorient them, but this is not something we did to you. You voluntarily came to do the surgery anesthesia. So the moment that started getting very disrespectful, and it was very clear from my end, because I was more clear-headed because I wasn't under the influence. I said, I was trying to just show that we're helping. We're trying to be helpful. And the moment the disrespectful behavior and talking, which I assume probably happens in their life, even though they're under the influence, I felt, my ego felt like I had to say, no, it's Dr. Cady, because I felt like I was getting trampled on. Like, I felt like this person did not know any barriers or boundaries and lost all respect for anyone around them, except for the surgeon who apparently walked on water. I'm like, oh, hell no. First of all, I'm a physician myself, but it doesn't make me better than anyone else. But there was that part of me that had to step in. And it was the only time I've felt lately that I felt like I had to assert that, other than for orientation purposes or whatever. But I don't know, any thoughts on that?
Yeah, I think it kind of goes with the general theme, right? I think there are people that really strongly identify as a physician. That is their core identity, as Dr. So-and-so. And I think they present themselves in that way. And then I think there are others of us who don't necessarily see ourselves as, my core identity is doctor. And we tend to present ourselves differently. In that particular scenario, it makes sense, because what you're trying to do is establish authority. And emphasizing I am a doctor establishes authority and starts setting out that hierarchy thing. What I would be kind of curious on is, outside of those scenarios, like when you're introducing yourself or introducing others at an event, is you said you see yourself as a Melissa, but I'm saying, how do other people introduce you to their friends?
Well, it's funny. Some of them,
or associates. I guess that would be the better, not friends, associates.
So I get called Dr. Cady all the time. And even when someone's coming by the house and they're a nurse, they still can't call me Melissa. They call me Dr. Cady. I'm like, it's Melissa. But I guess maybe sometimes people forget what my first name is, because they're so used to saying my last name. It's easier to just say that. But yeah, I would, if people have been in the professional environment and then are in a social environment, they still call me Dr. Katie. Um, but personally, even though they know I'm a physician, they've always known me originally as Melissa. So I don't know if it's just that's just what they're used to calling me, that's why it, perpetuates.
Or the
But
familiarity aspect of it.
yeah, and then maybe they forgot what my first name is.
Oh, I think we've talked about that before. Is you don't ever seem to be an expert to the people who knew you,
right?
Like that's the most frustrating thing for me is I have friends and family have known me since, family all my life and friends from kindergarten. And they, they'll say something. I'm like, well, actually that's not true. And it's like, I don't know. Sometimes I feel like they just don't take it seriously. I'm like, okay, whatever, whatever.
Yeah, I think that can go with, especially parents. Sometimes you're still their child in some way or another.
And I can understand that. I guess that it's really difficult. And I think this is a broader theme on a lot of things, is being able to identify the person away from the content, and then also identify what your identity is and why it's your identity. So for a physician, and if that's your core identity, I guess in some ways what I see that is then I would be very curious on how people who strongly identify as a physician, as part of their core person, that I am, like the one, like this whole thing, this I am, or this is, I am Dr. Kevin Cuccaro, or this is. And now that I just said that, I can't remember exactly how I introduced myself. But people who strongly identify with that I would just be a very curious conversation to talk to somebody who sees themselves so strongly as a doctor that I guess if you pulled that away from them for some reason, and you just imagine you are no longer a doctor, who would you be?
Yeah.
Right. I can pull away that doctor piece and I would still know who I am.
Yeah. Well, that's an awareness that I don't think all humans, and definitely physicians, I don't think everyone has that kind of awareness. You actually reminded me of that time when I had a surgeon, I won't name names, that I just mentioned their last name, trying to identify this
okay
here.
Yeah.
And oh boy, did that just slap me in the face later, not physically, but this surgeon was intensely furious, because even though I wasn't right next to the patient, they could have heard. And the fact I didn't say doctor in front of their last name, and I just said their last name, it was so disruptive to his ego that he couldn't get by with just letting it go. I was shocked. And I'm, a colleague who's a physician. It's not like some non-doctor is saying, calling him like he's some peon or some peasant. It just was baffling. It totally baffled me that day that person was so irate about that situation.
To you or to others?
To me.
Oh, okay. Were they unprofessional to you?
Well, yes. Yeah, in other ways.
Oh, okay.
Yes.
Well, because that's, I feel that's in the same role as your abusive patient that was potentially drug induced, or, part of anesthesia or whatever the perioperative medications were.
Yeah.
And in that role, I do think there's establishing a point of authority as well, because by them saying that and treating you that way, they're not recognizing your authority.
Yeah.
Right. And so they're, and anyway, we're kind of going all over the place with this,
but
it's interesting though, how we form these identities and how your identity evolves over time. And then when you put on a professional role, in addition to that, how you navigate that. Because I do think this becomes really important, because we're in an age where we're sort of, I'm going to use the word dumbing down, but there's active challenging against authority, and there's active challenges against education. And so we need to, we're as physicians, we're sort of navigating this world where people can get very upset if you emphasize you're a physician simply because you're emphasizing the physician, rather than something I'm expert. I'm amplifying my expertise is what I'm trying to do. And that's a fine balancing act, I think.
Right. Well, in some realms, they want to just call us providers and never say the word doctor.
Well, yeah, and that's a whole interesting realm. No, because we've talked about this before, is that language is important.
Yeah.
And the words that you use on a consistent basis are very important. So when we're talking and identifying somebody as a provider, we are either intentionally or unintentionally essentially removing that authority.
Mm-hmm.
We're de-escalating the authority of that's inherent in the word doctor or physician, right?
Right.
And we know that there are organizations that do this. Again, I think the background to that movement of changing the whole way that people are labeled in the healthcare field was intentional to start. And certainly I think people throw it around and they don't understand how important that is. I think there's a lot of people who unintentionally are like, well, who cares? It's provider. Well, no, it matters a great deal when we are navigating this world where there's defined roles, and those roles have defined expertise associated with them. When we start blurring those lines of expertise, we start to get into trouble, because now we don't know who is responsible for what.
Right. You're going to let the LVN be an anesthesiologist or a physician to, so you're making it seem like it's all the same. I mean, It's kind of important to know that.
And that really isn't a question of identity. Right. So, this whole conversation came out of this idea of doctor and identity. But when you're defining specific expert roles, that's not about identity. That's about expertise. And that is different.
Yeah, that's true. That's a good point. And I did want to pull this into the conversation. I remember we had our episode with Dr. Ali Abdal, or he just says Ali Abdal.
Ali. Yeah.
And I remember him saying it was a little pretentious for people to put all their titles and their, little acronyms and stuff. And that, so it makes you think from a cultural standpoint that in the UK that, they don't throw around the doctor maybe as much as we do. I guess that's the question. I don't know any studies that show that, but
well, we need some British docs is what we really need, because I'm very, very curious on that, because my idea, based on really nothing other than perception,
yeah,
which
is most of us,
is you kind of think that British society is more pretentious and integral. I mean, from my understanding, there seems to be much more inherent classism in Great Britain, because they have this landed gentry, right? In America, it's a little bit different. We have these wealthy families that have been around forever, but we don't have lords and ladies and barons and all this other stuff to deal with.
Yeah.
So I would be very curious on that, and maybe it's a role of seeing yourself as a professional versus a royal or whatever, the gentry kind of behavior. Maybe that's a little bit different, professional versus gentry, but I just have a hard time believing that's everywhere, and you got to remember, Ali was a resident, and he just was, or whatever, their equivalent is, and he's coming out of that role. Right. And that may be a very, very different space to be in, rather than their equivalent of an attending physician.
Right. Now I'm thinking about, this, I guess, when would you expect to be called doctor?
In a professional situation, mm-hmm. I expect to be called doctor unless I give permission otherwise.
Right.
I am otherwise really informal and about it. Like I pretty much sign my emails and everything, Kevin, blah, 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 unless I'm trying to make a specific statement, or it's a direct professional endeavor. And then I will emphasize the physician. I will tell you, the thing that absolutely drives me freaking crazy, like really pisses me off, mm-hmm. is when someone whose acquaintance or I barely know mm-hmm. introduces me to their physician colleague as Kevin, while they introduce me to their physician colleague as Dr. So-and-so. Mm-hmm. I find that really disrespectful. Mm-hmm. And maybe it's my own person, Kevin or Dr. Cuccaro, you're getting all worked up. But if you are going to have your friend and colleague and you see that they're a physician and you are and then you are introducing them to me as a physician, then you should have the same respect for me, unless you are trying to, again, de-escalate my authority. And I think in some ways that depends on the physician as well. Surgeons, I'd be really curious. We should talk to some surgeons, but my suspicion is that surgeons are held up onto this other pedestal. And I think more often than not that they are referred by the other staff, the ancillary staff, the other, clinical people as doctor more often than other physicians are. In anesthesia, because we have this weird role, I think a lot of times they don't recognize or see us as a physician. I think a lot of this comes with the language that we use, because how often do they refer to you as anesthesia? I don't know. I used to get kind of irritated about that. I'm like, okay, anesthesia is the stuff I'm given through the IV or through the mask. I'm Dr. Cuccaro if you have a question for me or you have something important that you want to tell me. But I do think that becomes this reflection of the importance of words and the importance of how we behave and how those can, again, unintentionally or intentionally influence the interactions that we have. Because I know a lot of people don't want to, I don't think they're intentionally trying to be disrespectful, but they're just unaware.
Yeah.
And then you think about, well, how that influences the interaction. For me, it immediately puts me onto this more confrontational style.
Yeah.
Maybe it shouldn't, because I'm a little bit more aware of it, but even being aware of it, there's still the sort of baseline set point that you're at. So yeah, it's really, really interesting to me. And it's really, really interesting. The more, all the stuff that we've been talking about on the podcast, particularly in this season, the more aware of it, the more you see how all of the stuff, how your perceptions work, how the words that you use, that the identity of that you have, the less you're aware of it, the more you are just kind of flinging back and forth with the world. You don't know how you're going to interact with people. You may say the wrong thing and then get like upset that they explode at you. When with a little bit more awareness of how this stuff works, maybe you can either interrupt it or change or recognize interactions. Like if you're talking to Dr. Cuccaro and you're introducing him to Dr. Smith, I'm going to introduce him as Dr. Cuccaro, even though he's a nice guy. I hope I'm a nice guy, but it's fascinating.
Yeah. So 3 things. One, you talked about just your friend who on the face of it all, like knows you originally as Kevin. So it's hard for them to flip it. So it would make sense that that's kind of like they're not aware of what they're doing. It's just kind of how they communicate and how they perceive you, at least initially. And that's not how you're labeled when they first met you. And then I think about something we haven't mentioned yet is that this bias, how it's been indoctrinated, pardon the pun, of, males as being physicians, that when you see a female, this happens to me all the time. Go in my scrubs to a grocery store. Oh, you work in the medical field? I'm like, yes. Like, oh, are you a nurse? I'm like, no, I'm a physician. And it's kind of like, I don't know how many times I've had to say that. And most of the time I just don't even give that information unless they start inquiring. And I'm just like, whatever, at least they can be educated that there are physicians that are females. And then there's this other part that as in anesthesia or anesthesiology, that we have multiple providers that happen to be nurses. And then you could hear certain nurses say that they were there first and then the physicians took over and yet maybe improved the safety protocols.
Did improve the safety protocol. I mean, that's pretty well established.
Right. And so it's like, sometimes the defense is, nurses started in this field and, kind of like that's the stake in the ground, whatever. We're not going to go into that conversation.
Barbers started medicine. I should cut your hair and take out your appendix still.
Yeah, that could be another episode. But what I will tell you is that maybe there's conflict. They don't, I get called Melissa a lot. Of course, I don't, when I say on a text message, because I do pre-ops ahead of time, this is Melissa Katie. Sometimes I'll put Melissa Katie, DO, in parentheses, anesthesiologist. So they kind of know more information about my name, but I don't usually say this is Dr. Katie. Like I usually so sometimes they'll just call me Melissa. And that could be just kind of how I, present my name to them, which is not the doctor in front. But what's striking is that I can't tell you how many times this happened in the pre-op area or before they're off to sleep or even in the recovery room. They'll say, have you, like, let me give you an example. Like, have you talked to, or they have a question about something like, I haven't talked to the doctor yet. And I'm thinking, is there only one doctor in this picture? Because you're talking to me. I'm a physician. And sometimes my ego will say, you mean the other doctor? just, but then most of the time I just keep quiet, and I'm very aware that I'm getting a little dissonance because what they're saying is not lining up to the reality of what I am. So those are some of the things you made me think of, like the whole male female, the put on a pedestal, the surgeon is really the doctor, and they think he's managing all this anesthesia stuff, with me kind of like just doing the dials. I'm like, no, they don't have a clue for the most part what we're doing. I mean, they know some stuff that's relevant to them, but anyway.
Yeah, I think in those situations, they say, oh, you mean the surgeon? That's what I would say. You mean the surgeon, right? So let's define the roles here a little bit more.
Oh yeah.
But I like how your interest, you recognize it because there's the ego and you're kind of see where it's triggering you, but at least you can then respond from an intentional standpoint, right? Or make a decision, which is all, making that decision with intent. The male female thing I also think is fascinating, because then we start looking again this hierarchical role.
Mm-hmm.
And the first thing I thought of, okay, what about male nurses, right? But I don't think I think it's still different for them. And mm-hmm. I think it is because, it's weird. It's not weird. There's a lot of male nurses, but people may perceive that different because being a nurse is traditionally more of a female role. But I don't think they have a challenge to authority because of that.
Yeah.
Female physicians, I think it's ridiculous the amount of kind of, again, either intentional or unintentional cutting into their authority that goes on in the medical system and outside the medical system. And I do think that has a larger frame of reference and gender roles and how we actually respond as society, and how we identify men versus women and kind of these hierarchical roles. But that I think there's a whole lot there.
Yeah. Oh yeah. No, I'd be curious, anyone that's listening, if they've had experiences, some of the worst and hardest are just the patient, knows you're Dr. Katie. They know you're a physician, but the first time they start mentioning your name, they act like you're a friend, like, Melissa, what do you think about this? And,
and even in the professional role though, mm-hmm. how often do you have nursing staff that use your name rather than Dr. Katie? And, Rarely. Or I've seen it in other healthcare systems. And the other thing is, okay.
Yeah.
And then how about in residency? Did they ever undercut your authority as a woman, or seem to be less responsive to your physician orders because you're a woman physician as compared to your male colleagues? Or was it something you're aware of or not? Because I mean, sometimes
I don't remember.
Okay.
I definitely had some harassment that multiple people had to report, but that's the last thing I remember of it.
From the nursings?
No, from a male physician.
Oh, okay. Okay. Well, that's a whole nother one too, in the amount of harassment that takes place in medicine. And I guess if people are listening out here, the important, we're not necessarily making this big judgment call and saying, oh, America sucks. And I mean, this is, people get all riled up, right? It's always like, oh, we're talking gender roles. Well, you're trying to change America. Oh, you're trying to advance feminazis and trying to make sure that women, I don't know, take over, like we're creating an Amazon society, and everybody, just because we're trying to advance equal rights for everybody, that women are now going to, I don't know. And if you're thinking that way, and actually it probably would be better for a lot of different reasons, because testosterone has been influencing violence by people, but
for generations.
But the key about it is the more aware that you are of these perceptual biases that influence how you act, again, it's going to influence you no matter what you think or do. The question is, do you want to be aware of these biases and these perceptual filters so that you're more aware and can be more intentional in the actions that you do, and intentional in your responses, that you can see a little bit more clearly, that you can take a different perspective on what it is for someone who isn't you? Or do you want to be ignorant and sit back and say, well, I have no biases? That's simply not true. People need to suck it up. There's no such thing as harassment. It's just locker room talk. It's just how it is. And if those women physicians wanted to do more, then they should stand up for themselves. I mean, that's such crap. And it is such a point of privilege to talk like that.
Yeah.
as the white male who's from the epitome of privilege in this stuff, it just angers me. And I think it angers me because of the fact that I hate bullies. Yeah. And that privilege is a form of bullying in my realm, or not my realm, in my
world,
anyway, no, we're kind of really going off of it, but
no, it's okay. I think, in general, I think overt, it's just like anything where people have not been respected or marginalized. Many times people don't believe it exists unless it's truly overt. Unfortunately, there's a lot of covert stuff that goes on where it makes people that don't live in that world of basically the privileged they can't see it. They can't see the covert unless you're looking for it and have, for some reason, had an awareness brought to your attention. Then maybe you see it and understand it. But I think it's no different than some of the situations where, we want to be respected for, not because we're better than, but more respected for the role we play. And that there's a certain responsibility and level of expectation for the role that we play. And it does bring along a certain amount of, I don't want to say pressure, but there's definitely, you have to live up to certain ideals when you want to be a good physician. And so I think some people take that for granted and don't realize that there's a lot that goes on when it comes to being a good physician. So I'm curious for anyone that's listening, especially if it's on YouTube and you're able to comment, we'd love to see a comment on, when you expect to be called doctor and in what settings and whatnot, or if you have any other comments related to this conversation. But anything you want to finish up with to take us out, Kevin?
No, I think you framed it beautifully. Thanks. And when you were talking about with elevated responsibility, like in these positions, we have a greater degree of responsibility associated. I reflected back on the words of that great sage and philosopher, Uncle Ben Parker, who said to his nephew, Peter, with great power, Peter, comes great responsibility. And it's quite true. As you move up that hierarchy and you have more authority, we need to be more aware of this stuff so that we can, again, be responsible in the use of that power.
Agreed. You're taking us out.
No, I'm taking us out. So
that's what I said. Doctor, can you take us out?
Hi, okay, I'll take us out. This is, or I am, depending on what your perception is, Dr. Kevin Cuccaro with my amazing, fabulous co-host, Amazeballs co-host, Dr. Melissa Cady, who is a fantastic physician. And this is the Change Physician podcast, folks. And if you're a physician or physician ally, again, we'd love to hear your comments. You can join the community at thechangephysician.com. And until next time, stay well.
Take care.